Pledge Light for putting this event together. Opioid Awareness Day is a very important day on our calendar, and I think people are beginning to understand that. And I think it's a very important day for two reasons. It's to increase awareness for people who don't know someone who's struggling with addiction or is not struggling with addiction themselves, because those people might not understand that this problem even exists. But it's also important for the people who are struggling with addiction, or someone who has a loved one who's struggling with an addiction, because when you are in that position and you live that life day to day, it's a very isolating feeling, and sometimes you could feel like there's no end in sight, and it feels like you're on an island and nobody else is experiencing what you're experiencing. And I think this is a very important event for the community to stand up and say to those people that you are not alone. There's many people out in the community who are experiencing the same troubles that you are, and we are here to change that. So I'm a numbers person, and to illustrate the extent of the problem, I thought it appropriate to look up the relevant statistics, and this is what I found. In 2015, there were 728 overdose deaths. In 2016, that number rose to 931. 2017, 1,033. 2018, 1,021. 2019, 1,196. 2020, 1,369. And last year, 2021, 1,526. And I think that illustrates not only that we have a problem, but that problem is getting worse. It's not getting better. We haven't peaked. We haven't plateaued. In all likelihood, 2022 will reach an all-time high for that number. And I think that that is something that maybe not everybody knows. They may have heard of the opioid epidemic, and they may care about it, but they may not know that it's actually getting worse. Okay, think about that. 1,526 deaths last year. That's 1,526 times that our community failed to give the resources necessary to a person who's struggling, trying just to survive. 1,526 times that we failed as a community to save a family that was living in crisis. And when you look at those numbers, it's very easy to feel pessimistic, to feel depressed. But when I look around today, I can't help but feel hopeful, because I see a community who acknowledges the problem, who knows it exists, and they're willing to stand up and make that change. And not only that, I believe we have the professionals who have the knowledge and the professionalism to address this problem with science. And that, at least today, gives me a little bit of hope for the future. So I just want to end, of course, with the hotline number, which can be reached 24 hours a day, 7 days a week, 365 days a year, and that's 1-800-662-HELP, 1-800-662-4357. If you are struggling with addiction, please call that number and see if you can't find a solution. But with that, I'd like to introduce Carolyn Wilson from GASP, a great friend and a strong advocate for drug abuse relief. Thank you.
Thank you, Mr. Mayor. I prepared my notes today. I have not a lot of time, and I don't want to miss any of the thoughts that I'm having. So, good afternoon. I'm Carolyn Wilson. I'm the coordinator for GASP, which stands for Groton Alliance for Substance Use Prevention. We recently made a small change to our name to reflect the changing language to reduce stigma from abuse to use. So I just want to note that. GASP has been around for 22 years serving Groton. We are the local prevention council serving Groton, and I'm happy to say that we have been a leader in prevention in the region for all that time. And one of our highlights, and this is going back 10 years, is we were one of the first towns to install prescription drug drop boxes in our police stations, which was a big deal. And I'm happy to say that program has collected tons, literal tons of prescription medications to date. So very excited about that. And most recently, to add another layer of prevention to that, our youth leaders at Groton Tech recently did a PSA called When Opportunity Knocks, Take It to the Box. That's available on YouTube. We are very happy and thrilled about that PSA, and they got national recognition for that. So there's prevention going on in all sectors of the community. We're so excited about that. So what I wanted to touch on today, my biggest message is that how inspiring it is that everybody's here together to recognize Overdose Awareness Day and to hear about the important things that are happening in our community and all the ways that we're working together. We're all committed because we care about people, right? So we're here to serve the community in whatever way is needed. And that could be multiple things. That could be on the prevention side, helping parents talk to their kids about substance use and the developing brain. That could be preventing underage sales to minors. That could be helping people get naloxone and learn how to use it. There's no shortage of ways that we can help the community. I know that we are supporting members of the community in the recovery, and we are identifying and helping at-risk youth, which is also great. And through education, advocacy, and policies, I do believe we're making a difference. And I just want to remind everybody there's help and there's hope. And I'm so happy to be working with everybody here in all the different important evidence-based ways that we do that. So thank you.
Hi everybody, my name is Jen Muggeo. I'm the Deputy Director with Ledgelight Health District, and I also have the honor of being the Project Director for our NLC Cares project. Our NLC Cares team is here with me today, and NLC Cares is a collaboration between Ledgelight Health District and Alliance for Living. We're really excited and honored to be here with you, let you know a little bit about our work. And emphasize that this is a collaboration. We're committed to working together, to pulling together all of our strengths and knowledge and resources to serve our community. On the other side of the Ledgelight van, you can take a peek at the Alliance for Living van. You may see it traveling the community, stop the navigators as they drive around, talk with them about overdose, learn about accessing resources. Before I go any further in sharing about our work, though, I do want to take a moment to recognize that this is International Overdose Awareness Day. It's a day that carries a lot of meaning and emotion for many in our community and many of the people who are here with us today. We may be thinking of someone that we've lost. We may be thinking of our own experience having suffered and recovered from overdose. We may be wondering, what can we do to address this public health crisis? Before we share that, some of those resources with you, please take a moment with me just to hold space for all of those feelings, for all of the loss, for all of the families that are grieving, and lift them up as we honor them and we reaffirm our commitment to recognizing that every overdose is a policy failure and we can do better. Thank you. So now let me explain to you what we mean when we say every overdose is a policy failure and what we're doing to both support individuals in our community and advocate for policy changes. The Navigator program works to connect people with the individualized information and resources that they are looking for to support their individual health goals and achieve what wellness and well-being looks like for them. There are people in our community who are looking to access treatment, and the navigators are available to connect them with information about evidence-based treatment for opioid use disorder. That means treatment with methadone or buprenorphine. We have clinicians that work with the navigators who can do field-based assessments and initiate prescriptions for buprenorphine, or the navigators can connect people with treatment through methadone. At the same time that we connect individuals with care, we advocate for policy change that makes that care more accessible. We're really excited about changes that have happened in Connecticut, including recent legislation that set the groundwork for DEMIS to put out regulations to allow mobile methadone programs. This is important work and policy change that has to happen now to save lives in our community. And I hope that you'll talk with us and learn more about this and be part of spreading that word. We also want everybody to understand that not everybody is ready or looking to access treatment, and not all substance use is disordered. There are people who use on a spectrum and may very occasionally use. They still need information that can keep them safe. We work to help people understand that our drug supply is very contaminated. There are resources that are available to them that can help them practice safer use practices, whether that's using fentanyl test strips, which we have available, whether that's understanding about the impact of xylazine in our drug supply, and understanding that there may be other medical interventions besides naloxone needed. Understanding not to use alone and raising awareness of never use alone hotlines and resources. Again, if you have questions about this and want to learn more, we hope that everyone that's hearing the message today on International Overdose Awareness Day becomes part of our team amplifying the information about evidence-based approaches to address this public health crisis. I'm going to pass the mic now to our team of navigators. They're out in the community engaging with folks, and I would love for you just to hear a little bit about what that looks like and means, because understanding how we receive people that we care about with love and compassion and without stigma and judgment and shame is a very, very important part of this work.
Well, thank you, Jen. Hi, everyone. My name is Donnie Rose. I am a navigator. Well, first thing, I'd like to, let it be known that we make ourselves accessible and available to the members of our community, that may suffer with substance use disorder. It's all about trying to help educate, train, and make resources available to them. And this is what we try to do on a daily basis. We make engagement, we try to build rapport, deal with them, have them comfortable enough to approach us. This is why it's very important, to be accessible to them. It's a serious problem that is taking place in our country, and stigma plays a major part, and we have no place for stigma when it comes to harm reduction and when it comes to the disease of addiction. So our main purpose is just trying to educate, trying to train, be in position for them, help them with the resources, with primary care, medical-based treatment, able to speak to us at any given time, having an open ear for them. And these things become very important. I bring my own life experiences to the job. Myself, my disease has been in remission for the last 17 years, which I'm grateful for that. But it gives me an idea what I'm working with, and for the people to have a great understanding of who they're talking to. And that's where the comfortability comes in. So we just want to be able to share information, help train, help teach, and just to be available. Thanks.
Hi, my name is Trish Rios. I'm a Cares navigator, and Donnie did a great job in describing what we do, but I also want people of Groton to know that we are out here we are out here every other Wednesday at the Human Services, but we're also driving our van around. We're all up and down Long Hill. We have participants that we work with out here that are, some are living in Tent City, and some are living up in their house with their family, with their full-time job and careers. This isn't a disease that is just for people that are homeless. We're out here all over Groton. And a big part of our job is as a person with lived experience, I have had 13 years in remission, and I think it brings the ability to talk to people and support people. Not everybody wants to stop using drugs. Some people aren't ready. So I think our job is to help people stay alive until they realize their worth and that there's a community of people that care about them and can show them multiple ways to recover. So that's pretty much what we do.
Good afternoon, everyone. I'm Margaret Lancaster. I'm a peer navigator.
My name is Ruben Santiago. I'm also a peer navigator.
And as Trish said, we're here to help save lives. And today we are going to give you a Narcan training, real brief. There's instructions inside the box as well, but we're going to give you a brief overview of what Narcan does. It does with opioids and if an individual is in means of overdose at the time. This is Narcan. And it's a 4 milligram pack of Narcan, which is 2 doses. The first thing you're going to do, is it an overdose? Well, you're going to know the signs and symptoms of an overdose. And those would be if someone is looking like they're sleeping, snoring deeply, you can't wake them or shake them, if their eyes are small pin pupilled, if their fingers are blue, their lips are blue, if they're hard to wake up, that could be a sign of an overdose. We say when in doubt, use it anyway, because it could be another medical condition that's taking place. But one thing what Narcan does not do, it will not hurt someone. If you give that to them, it only removes opioids off the brain. So the way to administer Narcan is to, go ahead, Ruben.
Always make sure that the person's head is tilted back. This is like a nasal spray. The red tip right here. You're inserted in the nose, push it all the way up. You wait 2 to 3 minutes, which will seem like an eternity. If they are not up, you administer it to the other nose, to the other side. There's 2 that come in the pouch, so it cannot harm you. It would only take the opioids off the receptors. I can take this right now, and it won't do anything to me. So it's only good if it's opioids on the receptor.
Now we also have a rescue masks. That is for, the rescue masks are used for rescue breathing. This one? This one? Can you hear me now? It better? It was off. Sorry about that. So the rescue masks are used for rescue breaths. 1 rescue breath every 6 seconds. This is for respiratory revival. These are used for other medical conditions that you may know of, but one thing is other drugs may be in a system that may actually need rescue breaths and a person has taken. So we give the rescue mask out for that opportunity for you to give someone rescue breaths if needed. I guess that's about all we have to say about Narcan. Calling 911 is first and foremost. Just remember that from the beginning. Thank you.
So thank you everybody for being here with us, for sharing time and space to honor International Overdose Awareness Day, to learn a little bit more about how we all can be part of the solution to this public health crisis. I invite you to come and grab one of our pouches. It's got 2 doses of naloxone in it, a rescue mask, breathing mask, lanyard to wear your naloxone around your neck and look like a navigator, and a card with more information. And thank you again for being here.